Good morning again. We apologize for the technical difficulties there, but we're ready to get it going. And I just want to say good morning, and my name is Nick Plott. I'm the Regional Manager for External Affairs of TECO Energy and a member of the Polk Vision Board of Directors. On behalf of the Polk Vision Government Advisory Team, I would like to welcome you all to the 2021 Polk County Legislative Warm-Up. Thank you all for carving out time to join us virtually today. Before we begin, I would like to encourage all viewing online of the opportunity to text your questions to the number on the screen, which is 863-899-9314. Once again, as the conversation continues, feel free to text your questions to 863-899-9314, and we will do our best to ensure those are answered. I would like to say a special thanks to my fellow Polk Vision Board of Directors for their leadership, to our event sponsors, TECO Energy and Citizens Bank and Trust, and to PGTV for live streaming and recording this morning's event. At this time, I would like to invite Representative Bell to lead us in an invocation, followed by Representative Tomko leading us in the Pledge of Allegiance.
Thank you. Let us pray. Dear Heavenly Father, we just want to thank you for today. Thank you for this great country that we live in. We pray that you please continue to be with all of our leaders, and we thank you, Father God, for Polk Vision, that we did have leaders that saw a vision to make Polk County a better place. Pray that please be with each and every one of us, and especially those less fortunate. In Christ's name we pray. Amen.
Amen.
Amen. Now, if everyone could please stand to follow me in the pledge. I pledge allegiance
To
to the flag of the United States
of America
and to the republic for
which stands
one
nation,
under God,
under God,
indivisible, with liberty
with
and justice.
liberty and justice for all.
Thank you, Representative Bell, and thank you, Representative Tomko. While our esteemed panelists are known to many, I would like to quickly introduce them to you. In the interest of time, the link to their full bios have been provided on Polk Vision's website. Joining us today are Representative Melanie Bell, Senator Danny Burgess, Representative Colleen Burton, and Representative Josie Tomko. And moderating our conversation today is renowned author, political scientist, and professor emeritus at the University of South Florida, Dr. Susan McManus. Take it away, Dr. McManus.
Thank you so much, Nick. Thanks to all of you who are tuning in. You have a great opportunity to ask questions directly of the people that represent you in Tallahassee this coming session. And thanks to Polk Vision for asking me to moderate this panel. What a pleasure and what an honor. Panelists, I'm going to take you alphabetically at first. We'll run through everyone, and then we'll go back through some other issues. Each person will sort of get a lead off. If you have something you'd like to say about an issue, just raise your hand and we'll try to accommodate. I've already got some questions that have been sent in, so there's a lot of interest in what you have to say and what you're going to do in Tallahassee. My first question to each of you, and we'll start with Representative Bell, is what is one of your top priorities going into this session thinking of Polk County? Representative Bell.
Thank you, Dr. McManus, and I appreciate you being here also, and thank you, Polk Vision. This actually is my second term. I'm considered a sophomore now. It's great to be back, and it's an honor to serve the people of Polk County. There's a lot of needs here in Polk County, as everybody knows, but there's also a shortfall in our budget because of COVID, the pandemic that we have experienced. So it's going to be slim to none, but so we'll see what happens, on the federal level as far as the funding as they come down. But education is huge to me. I'm fortunate to be able to serve on several education committees. And I'm fortunate to serve on pre-K through 12 on the Appropriations Committee. And, I've said if we get education right, we get the world right. So it's going to be a balance there of trying to make sure that we fund our education system the way that we should across the state of Florida, and that that there's opportunities for anybody that are sending their children to school, that we offer a great education for pre-K through 12. So that's probably my top priority.
Senator Burgess.
Good morning, everybody, and good morning, Dr. McManus. It's so good to see my favorite professor sitting there and moderating this awesome event. And thanks for letting the Zephyr Hills guy join the Polk County awesome delegation. It's legendary, and I'm honored to be a part of it, even if it's just a small part of it. So I'm in the Florida Senate. I'm your new senator in Senate District 20, covering parts of unincorporated Polk County. And I'm the chair of the Select Committee of the Pandemic Preparedness and Response. And you know, there's a lot of personal priorities and things that I think are really important to work on this year. I'm big with veterans issues and trying to combat veteran suicide. Always have worked on that. And I think that those issues like that are only going to get worse now, of course, across the board with what we've been dealing with in the tail end of this pandemic. I think the tail is going to be long. And so in our select committee, our mission is a big one. We're trying to analyze what happened, what we did in that response to what happened, where we're at now and where we're going. And I think we have to look at this through the lens of number one, we need to remain ever flexible because this is unprecedented for a reason. There's no playbook for this. And we need to, realize that when this happens again, not should this happen again, but when this happens again, we need to put ourselves in a position where we're better prepared for the next virus, the next pandemic. And that's our goal. That's our mission. Obviously, that's going to be probably one of the biggest things we tackle on top of our budget this year in the legislative session.
Thank you, Senator. Representative Burton.
Thank you, Dr. McManus, and good morning, everybody. I just have to, since I am privileged to be the chair of the Polk County delegation, I want to just briefly let you know that certainly we all know that Representative Hawkins had intended to be with us this morning, but had an emergency and can't join us. But I've spoken to Representative Killebrew, Senator Stargell, and Senator Albritton, who normally would have loved to have been here had they not already had previous commitments. But I told them I would say hello on their behalf. So I want to start with that and say they're sorry they can't be with us today. To Senator Burgess' comment about the awesome Polk County delegation, he is correct. We are legendary. And then I have to say we have a reputation of working together on behalf of our entire community, all the communities we serve, and certainly together towards goals for the state. That's unmatched by other delegations across the state of Florida. So kudos to all of us, and you're very happy to have you with us, Senator Burgess, as one of our newest members.
Thank you.
Having said that, too, Dr. McManus, asked us about Polk County, and as folks who are involved in Polk Vision clearly know, Polk County is a microcosm, if you will, a great representation of the entire state of Florida. Right? We have diverse economies, we have diverse populations, we have sadly a very high poverty rate that is higher than the state. That's been part of, unfortunately, our story for a number of years now, actually since certainly before the inception of Polk Vision. And I was very fortunate to be involved at the inception of Polk Vision as executive director when we started Polk Vision. And it's a long time concern of all of ours. The pandemic is an overarching issue over pretty much everything that we're going to be doing, even when we have conversations about previous pieces of legislation that might have gone through the House and the Senate but didn't pass the legislature or were vetoed by the governor, and people want to bring them back. We do look through a different lens today because of what we've been through and what our communities and our state and certainly our nation and the world have been through with the pandemic. I will tell you that since I'm privileged to be the chair of Health and Human Services in the Florida House, I mean, the pandemic is heavy on our minds in the Florida House and certainly in that committee space. Just last week, we passed a PCB related to protections for COVID liability only in the healthcare arena. So facilities, individuals, practitioners, provided them a measure of protection strictly related to COVID issues. Because, as we all know, it's called a novel virus for a reason. This is a virus that the world was unaware of, we hadn't dealt with before. Doctors, physicians, physicians, nurses, hospitals, long-term care facilities were dealing with an issue that none of us had ever had to deal with before. So what the bill proposes to do is to create that very delicate balance of providing them some additional liability protection or strictly related to COVID issues, while at the same time understanding that we need to make sure that the patients and residents involved in healthcare across our great state and long-term care facilities retain the protections that we always want them to have. So it's it's a challenging issue. It's important, and we will continue to move on that through the session. And like I said, that was a proposed committee bill, so it came out of the committee. That's something that I'm running. And then other issues that are coming in before us in the Florida legislature, the budget has already been mentioned. That's an issue for everybody in Florida, and certainly keenly for us here in Polk County. As Representative Bell mentioned, education is a huge bucket of our state budget. Healthcare, a large bucket as well. So those are the biggest buckets. Sadly, those are the places that people are going to look for making cuts. If we were to do across the board cuts, and this I don't think is what's going to happen, but let's just say we did a 10% cut all across the budget everywhere, the biggest hit would still be in healthcare and education, right? Because that's the biggest part of our budget. We are looking at close to a $2 billion, that's billion with a B, as in really bad, deficit to our revenue. And, that's going to be very, very difficult and challenging. And I'm fortunate to be serving on the Appropriations Committee, so I will have the privilege of being part of that conversation as well. Having said that, another bill that I'm running is a bill with the Attorney General to provide additional protections to elderly and disabled adults across our state. As we all know, sadly, we've had some well-known, but also many undocumented cases of abuse and neglect regarding elderly folks, elderly individuals, and disabled. And when the Attorney General has gone out to try to prosecute those individuals, she did not have all the tools in her toolbox that she needed. So Senator Burgess and I actually are working on this bill together to provide those additional protections across the board. And then I'll say one more issue when it comes to education. This is something that we're keenly aware of here in Polk County. We're fortunate that in Florida, students got back to school in some form or fashion, more so than they did in other states around the country. But that creates a real challenge for how we move forward with the assessment system that we have in place today. Certainly what we did pre-COVID isn't what we can do right now with COVID. And that's a daunting issue that Chair Latvala and the entire healthcare silo in the House, I know we'll be talking about, as well as the Senate. And I'm sure they will come up with some creative solutions that create a balance between, fairness, if you will, and making sure that we assess our students. We need to know where they are, right? Here in Polk County, thousands of students, one of the largest school districts in the country. We need to know where our students are today. How we compare that to where they were pre-COVID is a difficult challenge. How we move forward and make sure that we continue to assess them and make sure they're getting what they need is a difficult challenge. I happen to believe that here in Polk County and across the state, our school teachers, our personnel all across our school systems are prepared and ready to do whatever they need to do to make sure that kids are brought back where they need to be. But that's a huge, huge issue that's going to set us back, I think, unfortunately set these children back if we don't pay attention to it and move forward with them. Those are just a couple of issues, Dr. McManus.
All right, Representative Tomko.
Well, leaving me for the last, I think everyone pretty much covered what we're doing this session, but just want to thank you, Dr. McManus, for always being so willing to be the moderator for this panel. And like the other representatives and Senator had said, this is a very difficult session as we move forward. We have some really tough decisions to make on the faces of our budget. And we have a really great opportunity to push through some policy that can be really helpful, because we saw during this pandemic where we lacked and where we did things that were really well. For this session, I have, 3 bills that kind of were born out of what happened during this pandemic. And one of those being broadband infrastructure, which I am able to work with Senator Burgess on this bill. And so I think everyone kind of used here one of our other delegation members to run legislation. But that is a huge deal for my district. I know that broadband infrastructure is, we saw with telehealth, we saw with schooling, and we saw with people working from home where they just were unable to connect. And how do we bridge that gap between that digital divide in order to help students be able to actually do their schoolwork? We have companies both in Polk County and all throughout the state of Florida who are not going back to the office anytime soon. And that's a challenge for individuals who are working from home. We saw with the pandemic, people not being able to go to their doctor's appointments or having mental health issues. And telehealth was a huge help during this time. And so our goal is, how do we eliminate those barriers, and how do we encourage those companies to come in and invest in Florida and invest in these areas? Because it's not just the unserved areas, it's also the underserved areas that are experiencing this as well. It's not just over in my district in Polk City, where it's the vast majority is cow pastures. We see that some cities have blackout zones throughout them where the infrastructure was just not set up. And I look forward to partnering with our city leaders, our county leaders, and working on solutions for this. And I know Senator Burgess and I have been working extremely hard this entire summer to achieve this for our constituency, because this is such a big issue. Something else that I am working on is the unlawful use of DNA. And you might think, why is that a big deal right now? Well, with everyone getting COVID tests, guess what? They're getting your DNA. And so therefore, that is the most intimate information about yourself. And how do we stop people from exploiting that? And so we will be adding some criminal penalties for the authorization, not having the authorization to use that data. Another bill that I'll be doing is the alcohol to go, which sounds, not like an important one, but guess what it was? We saw that small businesses had to develop a new model for how they were going to reach customers during the pandemic. They were unable to do indoor dining. They were unable to have customers come and use their food and be able to purchase those great delicacies that they have. And so this is an opportunity for them to continue on with what their business model was during the pandemic, which was very successful. And it just codifies what our governor put into place and puts it into law so they can continue to do so, while we still have people who choose to stay home and order takeout, or those that choose to go out to a restaurant. I look forward to working with my fellow delegation members and with Polk Vision and the individuals in our great county as we work for this great session that we're going to have some really huge responsibilities. And I think it will be a tough one, but I think that great policy is going to come out of what we all have experienced during this pandemic.
Well, thank each of you. And I'd like to turn our attention now to several questions that we've gotten that all have to do with individuals and stresses in their lives and things that are on their mind. And one of the ones that's come up is property insurance and the whole insurance. People are really struggling with that. So if you'd like to weigh in on this, just by all means, we can just go down the line. You can pass to each other, or I could ask each of you to weigh in on it. But I think that's a real big issue. Property insurance, meaning homeowners, but also car insurance and the whole idea about the PIP program. Some people would like to know what you're going to do about that, or what you're thinking.
I'll jump on that if anybody wants me to.
Go ahead.
That's okay.
Just
all right.
Jump in,
so,
each of you.
So I had the honor of chairing the Insurance and Banking Committee in the House from 2016 to 2018, and I'm on insurance, or banking and insurance. They switched it around a little bit. I think because they realized the acronym in the House is IBS, so they didn't want to confuse the two. But anyway, in the Senate, we have a couple big bills, and I am actually carrying one of them. Senator Jim Boyd is carrying our property insurance reform bill, which is critical. This has been an issue that I was familiar with back in the day, and now it's today. And we need to provide meaningful property insurance relief to Floridians everywhere. It's out of control, and we have to do something. So Senator Jim Boyd, who chairs the Insurance and Banking Committee in the Senate, is on that. As far as car insurance goes, I'll speak a little more in depth to that, because that's the bill that I'm carrying. SB 54 would eliminate Florida's and repeal Florida's no-fault law, which is our PIP insurance, that $10,000 in coverage that you're all required to have in Florida's no-fault system, and go to what's called a mandatory bodily injury coverage program, which is actually $25,000 in bodily injury coverage. So why? Well, there's a couple reasons. Florida is not just an outlier. Florida is the outlier in the nation when it comes to using a no-fault system. Every other state in the union has a different model, and most all of them have a bodily injury coverage mandate like what we're looking to do in Florida. The reason being is PIP is ripe with fraud, and that's what's driving your insurance rates up through the roof. And so by eliminating PIP, you're eliminating that fraud, which provides reductions out the gate. But the other problem with PIP is the coverage. So $10,000 is a creature of the 70s. It hasn't been upped since then. And $10,000 is gone the second you enter an emergency room. Walk through the doors, it's gone. And so that's just not, it's not adequate, it's not sufficient, it's not right. And so we have a lot of people driving underinsured, which really is a cost driver for the system for those who have, reasonable and responsible levels of coverage. So basically the way Florida's law is currently is if I was to rear end Dr. McManus, but I only have PIP, I'm not required to pay Dr. McManus my insurance coverage does not cover what I did to Dr. McManus when I'm in the at-fault party. So this fixes that. It evens the playing field. Everybody would cover insurance for damages that they caused. And that's the right sizing of our system. I believe that it will provide reductions in time, and I believe that it will provide meaningful insurance coverage for everyone in the state of Florida. So I'm proud to have this bill. It's a big one. It's controversial. I made a joke in my first committee, like, hey, this is my first bill that I'm presenting. And oh, by the way, it's just like a glitch fix to Florida's automobile insurance policy. No, it's a massive sea change, but it's the right thing to do.
Would any of you House members like to weigh in on these insurance issues? Just please pipe up.
I muted my, I would say Senator Burgess's bill has a similar bill in the House. I believe Representative Brawl is carrying that bill, Senator Burgess, correct? And so it's an issue that's come up multiple times. I think to your point, Dr. McManus, we are seeing, and you've got 4 members on this panel today. We own homes, most of us own homes, we have cars. So this is a real life problem for everybody, right? I will tell you, I mean, when our property insurance bill comes, our renewal comes every year, I hear from a certain homeowner that I live with, that would be my husband, about the increased rates. So we see it too. This is a real life problem. And so I think a deeper examination, I think of both the House and the Senate taking a look at these 2 issues is important. It impacts people's bottom line, absolutely does. We, unfortunately, we do live in a state that has more than our fair share of natural disasters. And we all know that that plays a role in, at least in property insurance, right? But does it play an outsized role? And while I'm not absolutely familiar with the bill that Senator Boyd is running, I think it's a good idea that we're taking a close look at homeowners and insurance in general. We do have, our CFO, it falls under his purview, and one of his, insurance comes under his umbrella of responsibilities. And I know it's something he's very concerned about. And certainly one of the issues we have, in addition to those explained by Senator Burgess when it comes to automobile insurance is, and it's by region too. So the Tampa Bay region, for example, where we all live, has historically had one of the highest percentages of car thefts. And that sadly has had an impact on car insurance rates. There's lots of things that play into that, but Senator Burgess and Representative Grawl are working on an issue that's been in front of us many times. I think even when Senator Burgess was in the House as Representative Burgess, we were talking about it. But to his point, I think the time has come for us to take, to place a real commitment to doing something. And I see that happening in the House and in the Senate.
Well, thank you. Another issue that's been raised by some of our viewers is on transportation, besides the car insurance or whatever, roads. And particularly someone wanted Representative Bell to answer about what kind of roads that she was looking at for Polk County. But also I would ask each of you to weigh in on, after Representative Bell answers this, on what you're thinking about the toll roads, because several other people have also mentioned that. is that going to happen in a year when there's such a stress on budgets? So Representative Bell, take it away with the road projects in Polk County.
Thank you, Dr. McManus. As a former county commissioner, now a state representative, I've been very passionate about making sure that we complete the Polk extension, Polk Parkway. And so the plans has been from where it ends on Winter Lake Road to bring it all the way out to 17 and over to 60, so that we could, especially with CSX that has planted there many years ago, getting these trucks and everything out of downtown Bartow or around on Van Fleet and getting them over to the Polk Parkway. We have a lot of goods that that's popping up through a lot of companies here in Polk County, so we need to be able to transport and get the goods out and get over to, Tampa Bay, where the trucks are all going. So I'm very passionate about that. But also, I would like to see us continue with the toll roads across the state of Florida. If you have sat on Interstate 4, it's a parking lot, and all of us here in Polk County, whether we're going to Orlando or Tampa, are sitting there. So I would like to see us go forth with that. And I know that's the governor's initiative, along with the Senate president and our speaker, that there was funding put there. So I'd like to continue. I know there may be, like I said in the beginning, we're going to have to look at our budget, but I am very interested in making sure that especially the Polk Parkway continues to be built.
All right, Representative Tomko, weigh in on the transportation issue, please. The toll roads.
Oh, sorry, popped out. Yes, I think that this is going to be a very tough budget year, and we are going to have to really look at these projects to see how we can fund these initiatives and fully fund them. And it, like we have all said before, we're facing some really tough challenges, and we're going to have to make some serious cuts. However, we understand that transportation is what keeps our state going. And so I think that if we continue to look at where we need funding immediately is a really important thing, because we want to make sure, as Representative Bell said, that we can continue to have that connectivity from the Orlando area to Polk County and then through Tampa and on.
Thank you. Senator Burgess.
Thank you, Dr. McManus. And so I'm the new guy on the block, but I'm a big fan of infrastructure projects and had been working on many, and excited to kind of be back in the mix and continue to work on some future projects that'll enhance our connectivity and our ability to get from point A to point B efficiently and safely. I think unique times call for unique solutions. State Road 56 is a great example of that. We worked hard to find funding for this project to go from 2 lanes to 4 lanes. And what it required was an effort from the state down to the local municipal level and in the public-private partnership arena. The private sector, they donated right away. The city of Zephyrhills guaranteed 10% of a loan. And what was that loan? The loan was a state infrastructure bank loan through the FDOT, the Department of Transportation, that the county applied for and was granted. So the county had skin in the game. And because of that, we were able to really come outside the box and get this done when there wasn't state funding that was adequate to be able to ensure that the road was built right the first time, because it just gets more expensive if you try to expand the road later on down the road. So long way of saying, I'd be interested in seeing, and number one, I'm learning. Obviously, I'm new to Polk County. You have an amazing delegation, and so I'm going to rely on Representative Bell, Representative Burton, and Representative Tomko and the like to educate me more on how I can assist. And those are just some examples from my past life where I've seen some successes. So, if I could help maybe bridge the gap there, I'd be happy to.
All right, Representative Burton on the toll roads, please.
Thank you. So on the toll roads, I'm assuming you're talking about MCORS,
Yeah.
that project. One of the issues or challenges we have in Florida is, excuse me, to use my Polk Vision cup here a minute. Yeah. Is lack of a long-term statewide comprehensive plan for transport, in particular for roads, toll and otherwise. And that was, I think, one of the attractions of MCORS to the legislature previously, was that it was the beginning of a more in-depth study. As you know, Dr. McManus and all of our members know, there was, many, many meetings that were held with local representation, with folks who were professionals in transportation planning and transit planning to talk about those issues. When it comes to, so I'm in favor of long-term planning and building out a big plan. And what most of us are not aware of is that the great roads that we do have took years of planning, right? They didn't just pop up out of the ground. A plan didn't happen in a year and the next year the construction started. That's not how it happens. That's how sometimes we wish it would happen. It feels to me in transportation, and particularly when it comes to road construction, you've got to have this exacerbation of the issue. The problem has to get so bad before anything can happen. Those who are in transportation, particularly when it comes to building infrastructure, know that it takes years to get a project off the ground. So one of my concerns always is, let's look at Polk County's projects. We have projects that are already in work. We have projects that are already along the way, been through planning, that are part of DOT's plan. And, that's a process that in good faith, our local governments have come to hope, is reflected in how our projects are funded and how we move things forward. And then we interject a potential large funding for another issue that they don't believe has been that people don't believe always is fully thought out as part of a long range plan. I think we have to think long range. And when that happens, sometimes we have to take another look at some of our projects that we already have in the pipeline. And that's a long process. As an old Polk Vision person, I believe in process and in having those really difficult discussions, including about infrastructure, of how we do this. Let's look beyond our own borders. Sometimes we just have to, because we're connected to all the surrounding communities and the counties. Look beyond our borders, see how we connect to everybody else. Let's make sure everybody's moving around Polk County, which is, most of you on this call today probably knows, what larger than the state of Rhode Island. We need people to be able to move around our county and our communities. We also need people to be able to move around the state. And we've got to take a look 10, 20 years out and start planning now, because it takes a long time for these infrastructure facilities to be built. I've got to agree. The budget's going to be, it just is the problem. The budget is a problem. And when we look at the huge deficit we're going to have, everything is on the list to potentially be either fully cut, partially cut. I mean, that process has just begun, and we will know a lot more about it. Probably, we'll have another estimating conference. We'll know exactly what we're working with, and then we'll go to work, and each of the subcommittees will make their recommendations. And by the end of April, that's when we'll really know the answer about how everything happens. And then, quite frankly, as you know, Dr. McManus, and everybody on the call is well aware of, then the governor gets to take a look at it. So we've all had projects not make it past the governor's veto pen. So we'll see what happens on that. But everything's up, unfortunately, up for cuts due to the budget constraints that we have this year.
Thank you very much. Another big issue from the requests that we're getting and commentary. Obviously, we talked about, getting around and, insurance and our homes and all that. There's also a request, since so many people are moving in here, and this is a high growth area in Florida, that the cost of housing is going up. And so you also have a large segment of people in Polk County who are having difficulty with affordable housing. And so the question was whether you all expect that something will be done at the state level to help fund affordable housing issues back in the local areas. So if you wouldn't mind, Representative Tomko, could you start with that?
Yes, absolutely. So last year we were fully funding the affordable housing, but unfortunately with the pandemic, what we saw was that, like Representative Burton touched on, we just had difficult decisions to make. It was a time where we needed those funds for other things during the pandemic. And so I think that as we continue to move on, obviously that is something that is at the forefront of all of our minds. It is something that we as a legislature pushed through last year. It's just a matter of how we are able to do it in this climate, in this budget climate that we have. I definitely know, looking at all the houses in our area, the prices are going up. People are moving to the state of Florida because they're running away from the up north where they're unable to continue to work and send their kids to school. And so we do have a boom here in Florida because people want to come and live here, and especially in Polk County, a place of great opportunity, both in the workforce and also for schooling for their children. And plus, it's a great place to live. And I would say that this is something that for each of us is important because we want to make sure that we are helping out those individuals that do need help. However, as we all have touched on, this is a very difficult budget year. So I'm not 100% sure, nor can I speak to whether we're going to be able to fully fund that like we did last year. However, I know that we all talk about this in everything that we do and when we're having those meetings. So if there's something that can go down, as Representative Burton touched on, we have to wait to see what our fiscal situation is going to be because we haven't even had the March revenue estimating committee. So we need to really be able to evaluate where our state lies in the matter of the budget before we can say yay or nay as to what we're going to do on that front.
Would anyone else like to weigh in on that issue, affordable housing?
Well, I will, if I could just real briefly. I would say, here again, affordable housing is an issue that we have been keenly aware of. It's been the top of mind here in Polk County for decades, for a very long time. And back, I know years ago when I was employed at Polk Vision, when I was executive director of Polk Vision, we actually had a day-long summit on affordable housing, where we brought in people from around the state, from South Florida, from all over the state, to talk about what they were doing in their counties and their parts of the state related to affordable housing. It is a real problem. It's going to be, I don't want to see quite frankly, parts of California where, teachers, firefighters, people with jobs cannot afford to find a place to live. And it's not just always home ownership, it's rent as well, because, as the ownership prices of homes go up, so does rent. And rent can be very expensive in some parts of our county. We have a large segment of our county that works in the hospitality industry over in the greater Orlando area. Across that part, actually here in Polk County as well. Huge hospitality industry here in Polk County. And we don't want to price them out of the market for some place to live. So I think it's going to take some innovation. I think if we look to a single source, be it the state or the federal government, or as a solution to this, that's a problem, because a single solution is not going to happen. To Representative Tomko's point again, I mean, Dr. McManus, we're all going to say the budget, because it's real. I mean, the problem is real, but the problem of affordable housing is real too. And we need to understand that particularly for those of us here in Polk County, we live in a county, we serve a community with many members for whom this is a problem day in and day out.
Thank you. Another topic that's on a lot of people's mind, and it relates again to the quality of life. We've had a theme here this morning where we've been talking about issues that affect individuals in their quality of life. And as you mentioned, a lot of people move to this county because of the quality of life is good. But another issue that's really on the minds of a lot of Floridians and a lot of people in this county relates to water. And you just saw the crisis that the state of Texas has with water. Water is very, very, very important to our state. And so there are a number of bills on what to do about it. And if you would like to weigh in on what you're thinking or what's of your interest right now on this topic, please do so. And we'll start with Representative Bell.
Okay. Thank you, Dr. McManus. Just had this conversation last night with my daughter that actually serving on the Southwest Water Management District. And, water's the number one commodity. We get up in the morning, we want to brush our teeth, we want to turn on the faucet. And many years ago, up in the Four Corners, Poinciana area, they turned on their faucets one morning and had no water. And so here in Polk County, we started the Water Cooperative Board, which is has been all cities. I think one out of the 17 cities is not on board with it. But as a district, as a region, we need to be all on board, planning ahead. 6 months from now, a year from now, I think 10 years from now, they're saying that if we don't do something, we will not have water. And so the bills that are being filed in Tallahassee, and Representative Tom Coe is on the natural resources, and I know she's wanting to pipe in on the water initiative that she's been very involved with. But water costs money, but it's a commodity that we have to have. So we have a great, like I said, great county commissioners that's been able to foresee that we're going to have some issues coming up, and working along with not just the state of Florida, but also Southwest Water Management and our other districts.
Thank you. Senator Burgess.
Thank you, Dr. McManus. And I'll just add to Representative Bell's answers, because I agree with everything she said, and there's not a whole lot more that I could say to put to that. But of course, it's probably one of the most critical issues we could ever face. The legislature is very in tune and sensitive to these issues, and always looking for ways to improve access to quality water, and ensure that it's always there, that our infrastructure is always ready to meet the needs, and to hopefully avoid any situation that could happen, like what occurred, the tragedy that occurred in Texas. So what I'll add to that really is that I'm excited to hear from Representative Tom Coe, who is our local ag expert. And also we have an amazing Senate President, Wilton Simpson, and he is Mr. Ag and Natural Resources, and he has been working on water quality issues for years. I know Senator Albritton has as well, and Senator Stargell. So, we have some serious, and I don't include myself in this mix, we have some serious experts in this community on this very issue. And so I think you're in good hands.
Well, let's pass to Representative Tom Coe, since he just gave you the shout out on this issue. And me being from an agricultural family too, I know it's very important, water.
Absolutely. Well, thank you guys for hyping me up. I hope I can live up to the hype on this one. But Dr. McManus, you say it right. And I know we have talked about our agriculture roots and background that we both share. Water is a problem when you turn on your spigot and there's not water. No one ever thinks about water being a problem until they don't have it, or either they have too much of it. And so right now in our budget, we actually have, around $28.5 million in water projects that provides funds for stormwater, wastewater treatment, water supply projects, and water quality improvement projects in local communities. We also have drinking water and wastewater revolving loan programs that have low interest loans for construction of drinking water systems, wastewater treatment, and stormwater management systems. This is definitely a focus. I don't know if any of you were able to hear, and I know the members were, but I mean the listeners of both the Senate President and our Speaker. Water issues are at the forefront of what we're going to be working on this session. I know that I have a big responsibility, and hearing all of those members' projects from all over, coming from the Panhandle all the way down to the Keys. There are a lot of people who want, quality drinking water. And so it is my mission. It is the mission of the Florida House to make sure that we invest in those programs as much as we can during these times, to make sure that we don't have a situation as a Texas had during this storm that they just experienced. And so Florida has always been on the forefront of these issues because we're surrounded by water. And as my district knows, even in Auburndale, some of us are underwater. And so we have a lot of different water projects that we're going to be working on. The Speaker of the House even discussed the resiliency projects, which I think are very valuable and we need to invest in, because we have existing structures that just can't handle the amount of water flow that is coming their way. And so talking about lack of water and too much water, we are targeting those very important issues, and look forward to helping our community make sure that we can achieve our goals and also those around the state.
Thank you. I want to switch subjects a little bit here. We talked about water and all the other things that are quality of life, but we really need to focus, I think, more explicitly on healthcare. That's a huge portion of the budget. There's a lot of different proposals before the legislature. And let's start, and you can just take up the issues that come to mind on that you're working on. Let's start with children's health care. We know there's some suicide issues related to a lot of other things, but the schooling issue and health care for children is a really big concern with so many families right now, every dimension of it. So we will start with Representative Burton on this one.
Okay, so I will start with healthcare and children.
Yes, please.
For those, for children in Florida, the largest number of individuals in Medicaid in Florida are children. And actually Medicaid pays for the larger percentage of births in Florida as well. So we have children from pre-birth until, from when they're born for many, many years. Some of them are in the system. So that is how, for children who are in families that are unable, who qualify for Medicaid, many children across Florida are covered by Medicaid. So that's for basic health care. The challenge is, even when you have a plan, do you have access, right? Are they aware of how to take advantage of their plans and how to access those plans? That's the responsibility of the managed care plans here in Florida, to work with them to make sure that happens. I will tell you, somebody earlier mentioned telehealth. We found, especially during the pandemic, which has just absolutely exacerbated all issues related to mental health across the state, across every age category. And we are finding that actually telehealth has been a great contributor to access for mental health issues, and opened up lots of doors for individuals for whom, it was either difficult because they couldn't get to a practitioner, or B, there was not one or enough, quite frankly. When it comes to mental health, we don't have an abundance, or let's just say we don't have an overabundance of practitioners in that particular area. And it's a real issue. And I think it's something we all need to be very, very concerned with when we move, especially when we look at children. We know we provided funding in previous sessions for additional mental health services to children in schools, but they weren't in school all year, right? We haven't had them all in school this year, and that's been a real problem. And actually, one of the funding requests that I have been, this session has to do with our virtual school, Florida Virtual School. Those students did not have access to mental health resources. So we are asking for some funding for those students as well. Because if your education source is online, if you're going through Florida Virtual School, we want to make sure that all of the various supports that we can have in brick and mortar schools are available to you. Also, if you're at home, if you're learning at home. And the fact of the matter is, I agree with the statement Representative Bell made earlier regarding education, education being just the key to life, but health is right there next to it. They're next door neighbors. They're hand in hand. If we don't have quality health care available to our children, to all Floridians, but we're talking children now, but to children, their futures can be severely impacted in a not a positive way. And so I think the more we can do related to telehealth and access for children, particularly when it comes to mental health, and other various practitioners who can also meet them through the telehealth systems is great. I would say that our children, we've seen a huge growth in the number of enrollees to Medicaid during the pandemic, hundreds of thousands. I will tell you, most of those are families with children.
Thank you. And Senator Burgess, you have 3 little ones, so I'm sure you're aware of how important health care programs and funding are to young people. What are you looking at in terms of legislation in the Senate on that issue?
Thank you, Dr. McManus. And I just want to say thanks to my good friend and former colleague, Representative Colleen Burton. She is she's leading the charge on healthcare in the House, and she hit the nail on the head. And I know she has little grandbabies. We talk about them, and I see pictures of them often. And so, with my 3 little kids, I can only add to what she put there. I have a 7-year-old, a 5-year-old, and a 2-year-old. My wife, Courtney, and I, who I know you know very well, Dr. McManus, is, we're we love our little kids and we see the impacts of COVID and what it's had on them every day. And they're resilient. They get it. You know, we've talked to them in ways to help them understand what's going on. But I'm really worried about the long-term second and third order effects that will linger long past this virus. And, you know, my daughter, she wears a mask to school every day when she goes. You know, she does kind of a hybrid model with virtual and in person. She's in person this week since we're home. You know, and she would ask questions to Courtney and I, you know, like, you know, am I going to have to wear a mask forever? You know, and you're not interacting with your other students and friends like you used to. And that really can take a toll on a young, impressionable, innocent mind. You know, she's had moments where she's been super worried about giving the virus to, you know, like my brand new baby nephew, my sister's, you know, who Josie's very close to, my sister Emily, and, you know, baby Barrett, you know, like just absolute, almost like a panic attack as to whether or not, you know, she could give this baby the virus and how dangerous that would be. And so I'm just so, if we're seeing this in our household, you know, I'm just so afraid of everything that every parent and grandparent is going through. And so I guess that's a long way of saying mental health is absolutely a critical issue in this day and age. It was important before, it's even more important now. And that's something that our committee in the pandemic response is focused on. You know, we have to get this right. We have to infuse the resources that we can to make sure that we're there to meet the needs. Like I said, this is gonna be a long tail on this virus. And so we have to be ready to meet that. And we haven't even seen the worst of it yet, I don't.
Thank you, Senator.
And I'm a glass half full kind of guy. I'm a positive person, but there's just realities that we have to get out there. And that's one of them.
Representative Bell, this whole issue of funding children's health, and we've talked a lot about the mental stress and whatever. Have you had any kind of input from people who are worried about the health and safety of children in homes where the domestic abuse has gone up in light of the COVID and being coped in and economic stresses on families? Is there something underway in the legislature on that front?
Very much so, Dr. McManus. When we started committee weeks in my education committee, we had 93,000 students that were missing in the state of Florida that had not shown up for school. We could not track these students, didn't know where they were at. Now we're down to, parents have been putting their children into school now. Now we're at 62,000 children that we do not have any contact with. Mainly they're kindergarten and first graders that the parents decided not to send them to school because of the COVID, didn't want to expose them. But there are also, you know, middle school, high school students that we do not have contact with. So you can imagine what's going on with these children that are not being seen each day or not being fed each day. And so there is a lot of concern out there. And so we're actually going to try to put forth more funding for truancy officers along with counselors in schools to find out where these children are, to go out and track these children. So this has been probably the number one topic the last 3 weeks in our committee meetings about, you know, where these children are. I mean, we're funding education. You know, the teachers are there ready to teach, but yet the students are not showing up.
Very, very good point. Last word on children, and then we'll move to adult health care. But Representative Tomko, about what's your views on the health care for children issue?
Yeah, so just to elaborate a little bit about what Representative Bell was discussing, I've done a lot of work in child welfare during my time in the legislature, and seeing the numbers, you know, one would think, oh, the reporting cases are down. That is actually a bad thing. And so my heart just goes out to all these children who were at home and in homes that weren't loving. And so as we see those cases and reports going down, it's just like Representative Bell said, we have a lot of missing students. We don't know where they are. And I think it's really important during a time that we clearly see the mental effects of this on children. How about those that can't go home and feel loved? So I think it's a really big issue. And I know that the state legislature is working really hard with those child welfare professionals to make sure that we figure out where those children are and how we better assess their needs.
Thank you. As I mentioned, we'll shift now. Healthcare is on the minds of so many people. Medicaid in particular is a very, very expensive program and expanded in times when people's incomes have been cut dramatically by the pandemic and so forth. And I know the state is struggling with Medicaid funding, which is a major source for poor elderly individuals, but also middle-aged individuals as well. So please address, and we'll start with Senator Burgess, healthcare concerns and targets of what you're discussing in the legislature from the adult perspective, Medicare, Medicaid, whatever you would like, but particularly the Medicaid issue.
Thank you, Dr. McManus. In light of the challenges that we face, we have to get creative. When I was proud to pass a bill when I was in the legislature in the House, and I'm looking at ways that we can expand the scope of it, to use that phrase, and that was the direct primary care bill. Direct primary care allows for families who otherwise could not afford a standard health insurance plan, and there's no income driven requirement to this. It's just it allows for additional access, and what it is, it's a contract directly with your doctor. So it's patient to doctor, there's no middleman, there's no insurance in between. You contract and pay a lump sum per month to your physician for routine primary care and proactive health needs, and that's phenomenal, because what it is, it's like $50 an individual, a lot of times maybe $150 for an entire family. You can go see your doctor as many times, whether it's telehealth or in person, as you need, based upon that contract. And so we as a state are trying to break down barriers to access and increase access to quality healthcare. That's one big way that we did it, and the thing now is just getting the word out, right? Like, you can do it. Doctors are able to do it. Patients are able to take advantage of it. We just need to make sure people know that that's a thing. And so we're working hard to do that. The other thing, I'll just kind of bring it back into the pandemic, of course, since that's the world we're living in, is, we're trying to find ways to increase access to vaccination. So I have a bill, I think it's SB 494, that would permit pharmacists, whether it's a Walgreens, a CVS, or your local pharmacies, to be able to, if they're certified based upon the current standards of, like how they can give you a flu shot, would be able to administer a COVID-19 vaccine or other CDC, FDA approved vaccinations that are on that schedule list more efficiently and readily. That way we can help people who choose to get the vaccine to be able to have that access to that. And so we're working that bill through the process now and kind of running through that. It's been through a committee, but we're trying to get creative, trying to find ways to ensure that we can get on the other side of this and in a better spot because of it. I know in my community, this would, and I think in all our communities, this would be huge. I mean, I have some really large senior living communities in the Zephyr Hills area where I'm born and raised, and there's a Walgreens and a CVS on every corner. So instead of these long, obviously it's a supply and demand issue right now, but once the supply comes in, instead of these long lines at certain key locations, the vision and the hope is that, you could just literally, maybe even in some instances, take your golf cart down to Walgreens and be able to get your vaccine that much more efficiently.
Thank you. Representative Bell, if you could address a little bit more about Medicaid funding, and explicitly, there's hope that maybe some funding will be coming out of Washington that would be used perhaps to help cover some of the shortfall, which looks like it's there for Medicaid. I know hospitals are worried about cutting their rates when they're already operating on the margins. Speak a little bit about some of these health issues, if you would.
Well, I probably should throw this over to Representative Burton because she's over the healthcare program. But, as you stated earlier, that Medicare costs a lot of money. And for us to expand our programs, it costs the state of Florida a lot of money. Where we are targeting it is the scope of practice. We are looking, actually, I'm running a couple of bills with podiatrists and also the insulin drug, trying to, if you have a child or if you're a diabetic, there's 5 to 6 drugs that you're prescribed each month, and it's costing our families somewhere's up to $800. So I'm running a bill actually this year to cap that amount to $100 for insurance companies. So we'll see where that goes with that bill. But you know, absolutely what we've seen. But I think telemedicine is where we're going. We saw this, you know, it's a whole new world now with what COVID has done for each and every one of us. And so if we could expand the scope of practice on telemedicine, where you're able to, you know, do a Zoom call like we're doing now, the doctor's able to look at us, and even there's things that, you know, there's they come in, shows you know, you can even check an ear, you know, the doctor can look in your ear through telemedicine. So there's all things that, you know, different things that have come up that we may be able to expand, you know, the Medicaid and Medicare system through this scope of practice. But I'm going to pitch it over to Representative Burton, because she has been the leader with healthcare.
Absolutely. And we weren't, I won't say we were saving her till last, but you did a great toss to her. And I know she knows about this Medicaid issue, which is on the minds of so many nonprofits that are helping people and individuals. And if you would comment on whether you think things are coming from the feds or what ideas might be out there to help bridge this gap.
Well, so Medicaid, as I mentioned earlier, our enrollment in Medicaid has gone up by several 100,000 during this last year due to the pandemic. And we currently serve about 4.5 million Floridians, or, you know, vulnerable Floridians through our Medicaid program. And the Medicaid program is an entitlement program. I mean, if you qualify for Medicaid and you want it, you're going to get it. You're absolutely going to get it. So the challenge to our budget is, it is something we are going to do. It is a program we are going to fund, whether or not, which makes a bigger impact, you know, that ripple effect, and I'm looking down at my own hands, but the ripple effect of that across the rest of our budget is going to be significant. So to your question, Dr. McManus, about whether or not federal funds, you know, there will be federal funds that will be available to assist us in balancing our budget. That's a great unknown right now. Let's say that does not happen. Let's say that doesn't happen. The fact of the matter is, we're going to have to take a look at, you know, the entirety of our budget. Medicaid will be funded. Might there be some changes in Medicaid, not to the individuals, but to the practitioners, to your point, to hospitals, might they see a difference in their funding? I think that's, I mean, if they're worried about that, I would share their concern. I would absolutely share their concern, because, you know, this is a hit that we're taking as a state, and we're taking it all across the state, the budget deficit. Everybody in the state is going to be impacted, including when it comes to Medicaid, those who provide care to our Medicaid patients without cutting services to our Medicaid patients. So what that is, I don't know. In the healthcare budget, there are a number of what we call projects that are funded. I don't have the budget, you know, the project list in front of me right now. I do know we have seen a reduced number and in the dollar amount of projects generally across the whole budget that members can just submit. I think for members, if we have projects in healthcare, and those projects will probably get a very serious, you know, look taken at them. Are they an issue that helps us, for example, you know, across the state? Is this something that in any way can impact our population that's served by Medicaid that could help reduce costs? I mean, those are issues that we're going to have to take a look at, and it's a huge problem. That's a really good, you know, the federal government money is a great question. I mean, we don't know, you know, what may or may not be available. We don't know how it can be used if it comes to the state of Florida, right? So, you know, the next 2 months, as we said before, are going to be very, very busy. But the Medicaid, you know, Medicaid is there. Medicaid in and of itself is a program. It's there. Sadly, we've had many more people qualify for it because of the pandemic. And I'm sure at some point, when we've got a few minutes left, we've got to talk about unemployment. But anyways, that's part of the issue. That's part of the issue. So through the appropriations process, they'll take a serious look at it. And then when individuals come to our committees for a policy issue that in any way impacts additional costs to the system, we're going to take a really hard look at that and have to question whether or not that's something we can really do this year. That hasn't happened really yet, but it always does. We always look for ways to serve more people. And unfortunately, in a year like this year, that's going to be very, very difficult to do.
Thank you. I know we're just got a couple more minutes, so if you all could just quickly go through two more issues that are very, very, very important. One is the whole unemployment technology, all the problems with the distribution of the information and the access, the technology part of the unemployment system, which we also saw affected the voter registration system. And we're seeing that affecting the distribution of vaccines. What's on the front, I think at the top of the issue is, can these technology issues, can Florida get into the 21st century on some of these key relief issues that are so important? Start with you, Representative Tomko.
Thank you, Dr. McManus. So I can speak to everyone on this call, or for everyone on this call, when I say that this entire last year, this has been our main focus, has been the unemployment system for our constituents, and trying to get those individuals the relief that they needed. I know my office personally, we had over 700 unemployment cases because my district is right around the hospitality industry that I know Representative Burton was talking about at the beginning of this meeting. I have constituents that work in all the theme parks, work at the restaurants, work at the hotels, and all of the surrounding areas. And so it was a huge problem. What we saw was that our system was unable to deal with the amount of people that were flooding into the system to get their benefits. And we're seeing that on every level, like you're saying, with the vaccines as well. We are seeing that there are just such a large number of individuals that are going through and trying to access these websites. I know for the unemployment system, there were even some situations where it might have been just the form, something was wrong on the form, and that's what caused a lot of the backlogging and unable to process the benefits. And so my office, and I know all the other representatives in Senator on this call, their offices are focused on trying to help those constituents that are experiencing these issues. I think the state needs to update its systems. I think that that is something that we can all agree on, that we have to come into the 21st century on all fronts. But however, if anyone is still experiencing anything on the front of the vaccine or the unemployment still, please contact us, because we have been working so hard for the last year to make sure that we get the relief that our constituents and others need.
Thank you. Senator Burgess.
Thank you, Dr. McManus. And Representative Tomko hit the nail on the head. So in the Pandemic Preparedness and Response Committee, of course, this is one of the top issues that in terms of what went wrong during the pandemic and how could we be better as we move forward, and also help people who are still struggling with the system get through it now and get access to the benefits that they're due and owed. So we actually have, I was going to say Representative Eagle, because we all served with him in the House process, but now Director Eagle with the Department of Economic Opportunity will be presenting before our committee here soon in the first week of session, I believe. And they also have reports and analysis on and this is a critical piece of the puzzle. We will be generating a report based on this and our recommendations, and hopefully good policy proposals going forward. Scalability, I think, is a big thing when it comes to what went wrong and what could we do better. When we think of scalability, I think of things like Cyber Mondays, right? Or like a Black Friday, where businesses, Amazons, Walmarts, whatever it may be, they know they're going to have higher traffic, higher volume, and so they have the ability to scale that to meet that higher demand at that time. We as a state government and these agencies with these platforms, and it's bigger than just unemployment. This is just where the rubber kind of met the road this year, to put it lightly. We got to be ready to do that. We have to get into the 21st century. We have to harness the power of technology for the better. I think we've all seen how well it can work in the middle of such a challenging circumstance. Like it was said earlier, we live on Zooms now. I didn't know what Zoom was before the pandemic. Now I do. And I don't know that we're ever fully going to get away from it, because it's efficient and I can meet with so many more people and there's with the same amount of time on the clock. And so I say all that to say that we have to be willing to rise to the occasion and meet the times. And I think that the time is now to make sure that our state government, and we have a great advocate for this in the newly administered position that Jamie Grant's now the head of as our chief technology officer, where we're going to hopefully get to that point. He's been working on this stuff for years. So interoperability between agencies and connectivity, it's critical.
Representative Burton.
Did you say Burton?
Yes.
Okay, thank you. First of all, I'm glad that Senator Burgess talked about the fact that they had Director Eagle at their meeting, because what we know is that the governor has asked, they're auditing the system to look at what do we have. To his point, I'm going to assume they thought it was scalable to a certain point, right? But it clearly was not in a position to take the call levels that we had. How did we handle that? How could we have done that better? And how do we need to be prepared for the future? As Senator Burgess has also said, we hope we don't have a moment in time like we had this last year and this year now, but we have to be prepared for that. We clearly were not. It dramatically impacted the lives of many, many Floridians. Oh my gosh, the calls to Polk County offices, as every office across the state of a legislator, everybody was working together to try to make that happen. So we've got to see where the real problem was and then make a commitment to be prepared for the future. I think the same thing happened, Dr. McManus, as it relates to elections and the vaccine sites as well. They weren't scalable, certainly for vaccines. They were not a system that they had in place previously. And, we got to be a place that attracts the talent to do that. And that's one of the things that Jamie Grant's responsibilities when it comes from a statewide level is to make sure that we're in a place where we are attracting great talent to this state that can work on these issues always, that can make sure we are always ready in the event of an emergency. We're very, very good at natural disasters here in Florida at responding to them and getting help to people who need help. Well, this is a disaster. It's a different type of a disaster. And we need to make sure that we're in a place to respond quickly and appropriately to Floridians who need help, whether it be in applying for unemployment insurance, compensation, whether it be registering to vote, or whether it be signing up for a vaccine or any kind of medical care that they may need in an emergency situation. So this is a top of mind, I think, with all of us. We're all Floridians. We're all living through this together. We are in a unique position to be able to elevate the conversation and demand that we are prepared moving forward.
Thank you. Representative Bell.
Well, I would concur with everyone, what they just said, but vaccine is actually on top of my list today. We were not prepared whenever the first vaccine came out. My office was inundated, not only my office, but my home telephone number was also inundated of why can't I get the vaccine? Why can't I even get on the registry? And so here in Polk County, the county commissioners partnered with the Department of Health to set up a call center because the website was crashing. So I actually concur with what Representative Burton said. I mean, we need to have the talent here to be able to set up the websites and have the technology to continue on. We're still having issues with the unemployment system. They are auditing it. In the beginning, it was a blame game. It was whoever had paid for the vendor in the beginning, but now I think everybody has gotten over that and taken personal responsibility. Like it's time to make sure that we have, all Floridians are able to, the ones that are unemployed, to be able to sign up on the website to get their money coming in. All of our staff, each one of us, and we weren't able to introduce our staff. If we were there, in real time in person, we'd be able to, but each one of our staff was in the very beginning was just inundated, and actually Representative Burton got with Peace River Crisis Center to train our staff because we had people calling in that had no income. And I mean, they wanted to commit suicide the day that they were calling into our staff. They didn't know where to turn. And so our staff and along with us were trained on how to deal with the public, what to do, where to send them, talking about mental issues few minutes ago. But this has just been a very unusual year for all of us. And I'm not saying it's been any different for us, but that we're state legislators or senators and that we're representing you. But it has just been, it's not been just a regular year that we've been able to serve and represent the people. But, I think it's time to, quit doing the blame game. And now that, we have the technology to set everybody up to get these vaccines. And so hopefully, I'm way too young to get the vaccine, but hopefully by May or June, I'll be able to get mine.
Well, thank you. We've only got time for 2 more questions, so keep that in mind. The first one has been asked by several people in different ways, and it has to do with schools and other services, making sure that for vaccines, schools in particular, broadband for schools, that the rural parts of the county are being attended to and on people's minds. School funding, again, is part of that as well, but broadband and vaccines and so forth. So we're going to start with Representative Tomko, since you're the rural person here more than the others, and then we'll move through everyone else, and then I want to ask one final question. So try to make your answers to the point. Thank you.
Yes, absolutely. And thank you, Dr. McManus. I will go to kind of what I talked about in the beginning with broadband. So I and Senator Burgess as well have actually just filed the broadband infrastructure bill. Being that my district and me personally, I use 5 jetpacks here at the house to just be able to talk to you on this Zoom. And so broadband is a huge issue, and you will not be left behind. And I want to make sure that my constituents and other people throughout the state who are dealing with this issue know that the state legislature and me and Senator Burgess personally are working on this with our broadband infrastructure bill. We are working with the utility companies. We are working with our local governments. And we are even working with the Charter Spectrums and Comcast of the world to make sure that we can deliver broadband to these areas. So just know that House Bill 1239 was filed yesterday, and I think we have a Senate bill, I think it's 1259. I could be wrong, but those are going to attack those issues. And if there's anything that the school district may need from us to achieve this as well, please feel free to reach out, because this is a huge focus of mine this session.
All right, and let's see here. Next up, I believe Representative Burton.
I would say that Floridians who live in rural parts of our state deserve the same access to great education, broadband, healthcare. Where you live in the state should not determine your access to all those things that are vital to quality of life. When you choose to live in the beautiful rural parts of our state, congratulations to you that you're able to enjoy, one of the most beautiful states in the country, right? We're a great state. But if you live in rural Florida, that should not be a reason. That is not an excuse for you to not have great education, great access to healthcare, great access to internet, and all the things that make, that build for a quality life. I'm trying to keep it short.
Thank you. Yes, Senator Burgess.
Hear, hear what they said. I'll keep it real short.
Okay, thank you.
Everybody needs to have access.
Representative Bell.
Mr. Burgess and Representative Tomko's bill. I'm also, my district's very rural. I have Polk, Hardy, and DeSoto County. And so I've heard the cry of my citizens also of not being able to get on the internet. Just here in Fort Meade this week, the internet's gone down. Last week, actually 3 days, we had no internet, no Wi-Fi, and just for business to do business, they need the internet. So I agree with Representative Burton, what she said. Everybody deserves the same here in the state of Florida.
Thank you.
And also, Smart Cities actually is on board with that bill, and Fort Meade is, and Bartow is in Smart Cities.
Well, thank you all. Quick, just 1, 2, 3, 4, 5, because we got less than a minute here. People can't go to Tallahassee and easily talk to you or see you. What's the best way to communicate with you personally? And we'll start with Senator Burgess.
reaching out to our team. We're very responsive and we love our Zoom meetings. So, although you can't travel to us in the Senate, we can certainly travel to you virtually.
Representative
And
Burton.
hearing from you is still critical.
Okay, Representative Burton.
Very easy to get in contact with me. Actually, all of us in the House, our email addresses are our first name, period, last name at myfloridahouse.gov. A lot of people communicate via emails. Their emails are answered by my staff and myself. To what Senator Burgess said, happy to have conversations when we can schedule a time. And we've done a lot of this with local constituents for Zoom meetings as well, because it is difficult to access us. In the Florida House, people are able to make appointments with House members, but now that we're starting session, just the time for that would be more limited. But my email is a great way to get a hold of me, to get a response.
Representative Tomko.
I would echo what my colleagues say. Zoom has been wonderful because, as we know, you don't have to leave the home to come and have a conversation with us. And so my email and also my great staff, Barbara and Robin, you can communicate with them at any time and just know that what you say to them always gets back to me. And we will make sure that we set up time to either chat by phone call or by Zoom meeting, because I take phone calls on the way up to Tallahassee and on the way back because it's a long drive. So please reach out. We love to hear from you.
Thank you. Representative Bell.
I echo the same, and I also have an open door policy. I'm still meeting constituents in my office and also on Zoom.
Well, thank you all. We've covered the waterfront. Great questions. I hope we've addressed something that's of interest and passion to each of you. Thank you, representatives. And I'll turn it back to you, Nick.
Well, thank you, Dr. McManus, and thank you so much for your leadership on this panel today. It's been a phenomenal conversation, and just great to hear from our delegation and the great work they're doing for Polk County. But our time together this morning is drawing to a close. We hope you found the discussion informative and a valuable use of your time. We would like to thank all of the Polk County legislators who took time out of their schedule to be with us this morning. A big thank you to the team at PGTV who live streamed and recorded today's event. The recording will be available on PGTV's YouTube page. A sincere thanks to the Polk Vision staff, Kim Long, Talitha Bean, Brooke Dresser, and Kirsten Sheehan, and to all of you. Thank you for sharing the vision. Stay safe and be well.